we will move on to the next award. CADABAMS Mental Health Professional Award to Dr. M. Ranganathan. I would request Dr. Ranganathan to kindly come over and take the seat. Well, actually, Dr. M. Ranganathan would love to be called Dr. Marimuthu Pillai Ranganathan. He has an experience of 36 years. He has guided 35 MPhil and 2 PhD theses in mental health. He has published more than 75 articles in nationals and newspapers related to mental health, social work practice, social work education, and psychiatric rehabilitation. He is the life member of Indian Society for Professional Social Work since '67. He has been the member of several Board of Examiners, Board of Studies, and the PhD examiners. He has attended several national and international conferences world over in Netherlands, Germany, Jerusalem, Washington, and he is indeed a recipient of the Krupamayi Institute Award in 80, Nimhan's Best Service Award 2004, Sagar Award for Meritorious Service in 2004, and Distinguished Service Award IPS 2010, and MS Chellamuthu Trust and Research Foundation Award 2010. And now, ladies and gentlemen, he is receiving the CADABAMS Mental Health Professional Award. Dr. Ranganathan avarige ellರ ಪರವಾಗಿ ಅಭಿನಂದನೆಗಳು. Congratulations, Dr. Marimuthu Pillai Ranganathan. I would now request Dr. M. Ranganathan to address all of us. Please put your hands together for Dr. Ranganathan.
His Excellency, Honorable Governor of Karnataka, Honorable Minister for Civil Supplies and Power Energy, Professor Satish Chandra, Honorable Director, Vice Chancellor of NIMHANS, Mr. Kadabam Ramesh, the Chairman, Group of Institutions. While I am receiving this award, I am to remember with a great reverence of our National Institute of Mental Health and Neurosciences, where I was a student. I got my degrees at the postmaster's level and the PhD level, during which time my institute imbibed me the values in education, training and service in the field of psychosocial rehabilitation. That's where I do get the knowledge and expertise in relating the clinical diagnosis along with the social and rehabilitation diagnosis in understanding the persons with the psychiatric disabilities, how best with the social work methods in the application of treatment and rehabilitation, which could enable them to improve the quality of life and address the families who have been in distress right from the day until they get recovered. The patients and the families who we have been working with, I have learned the phenomenologies of symptomatologies, the disease process, manifestations, and the dysfunctional leading to disability, and to improve the quality of life. These many knowledge that I have been deriving, learning from these two categories of the clientele and the families, enriching the reward of knowing and do justice. And I am also indebted to Professor Sharda Menon, then the Director of Institute of Mental Health, Chennai, Professor Dr. G.N. Narayan Reddy, the Director and the current Country Director of Richmond Fellowship Society of India, Professor P.S. Gopinath, who is Emeritus Professor in Psychiatry. These people have imbibed in me, nurturing in me to acquire the skills to find justification in all that I have been doing in the name of psychosocial rehabilitation. I may also fail in my duty if I don't mention the sages and saints in our nation who have been advocating, promoting the concept of conceptualizing the concept of spirituality and mental health. The spirituality and the mental health, to many of you it may be surprise. The spirituality and mental health is in the course contents and with the 3 months training program for every psychiatrist in UK, wherein They are expected to understand the body, mind, the soul, beyond, with which one can emerge and continue to promote the psychological well-being. The gurus and sages, saints do remember us to induct and promote the spirituality dimensions in understanding of their disturbed minds. While we look back the 50 years ago of the Indian scenario in the context of mental health, courtesy to the wonder drugs and manpower development and multi-centered research findings and multifarious initiatives of different kinds do complement what we have been doing. It is you may be aware that the government of India has provided with 1,000 crore budgeting, keeping the NIMANS as a nodal center, assigning the responsibility to the young director, Professor Satish Chandra, to implement the national mental health programs all over the country. To support such programs, we do remember the Nations for Mental Health of WHO and the programs facilitated with World Federation for Schizophrenia and Allied Disorders. Such supports would come to handy, with which we continue to expect, continue to grow, and do find the place for our clientele and the family members to get the maximum benefit. With this briefing, I am to request our Director and His Excellency, the Governor of Karnataka, to continue to support under the context scheme of private-public partnership. Here is a private organization, well established, that is CADABAMS Institutions, which requires the support to work at the macro level, the programs which could address every needs that are being felt by the patients, families, professionals, and the community. With this briefing, I thank the Honorable Excellency Governor of Karnataka, the Honorable Minister, Professor Satish Chandra, and Ramesh Kadabam for gracing the occasion and give this opportunity for us to receive the award on behalf of the families of our patients. Thank you very much.